I saw another Hopkins trained physician post about this, Peter Attia, and discussing the increase in resting heart rate if you're on different GLP-1 receptor agonists or combined GLP-1 GIPs. We were discussing this yesterday, actually. This might be a good opportunity to discuss it. The change in resting heart rate with GLP-1 receptor agonists and also with the placebo group in the very large studies on GLP-1 receptor agonists. I saw another Hopkins trained physician post about this, Peter Attia, and discussing the increase in resting heart rate if you're on different GLP-1 receptor agonists or combined GLP-1 GIPs. And oddly enough, James dug into this, the placebo group, even though it is a number of thousands, had standard of care diet and exercise intervention, and yet their resting heart rate did not statistically significantly change over a period of 48 weeks, even though when you have monitored, so you know individuals are exercising, a lot of studies show a decrease in resting heart rate, let's say from 75 to 65 of 10, even in a period of 8 to 12 weeks. So that really makes you doubt the validity of, or at least the success of the exercise program. I guess at best, it tells you that if you tell people to diet and exercise, they probably won't.
I think that's the part of the study that I found as a red flag in the methodology, is that they had told the patients to exercise 150 minutes per week, but had given them no explicit instructions on how to do that and what exactly that means, and no monitoring and proof that they were actually doing that. Mm-hmm. Like you're saying, there's a lot of evidence that increasing your physical activity does drop your resting heart rate, especially in the BMI categories that were included in these studies. So it is suspicious, those results.
Mm-hmm. It's also concerning because if you think about one of the main critiques of fast weight loss of any type, not necessarily fat loss, but they really go pretty closely hand in hand. If you lose weight, you're going to lose fat. If you lose fat, you're going to lose weight. Almost without exception, not quite. But if you're talking about a large volume of weight, 100 pounds, you're concerned about the loss in lean body mass. And exercise is going to be, and specifically resistance training and hormone optimization are going to be some of the most important things for that. So that's one thing to keep in mind when choosing like what specialty a physician to go to. The more specialized the clinic, the more likely you are to have success with actually implementing the diet and exercise plan.
Yeah, absolutely.